Welcome to the Carson Tahoe Health Physician Training Series, Health Issues Manager. The overall objective of using the Health Issues Manager is to maintain an up-to-date problem list of current and active diagnoses for the patient. The health list serves as a centralized problem list for the clinicians to document and reference a list of diagnoses or conditions that the patient currently has or has experienced. Health issues are directly tied to the ICD-9 codes for billing and financial reimbursements, and also to meet the Meaningful Use 2 initiative slated for 2014. Here are some examples of health issues: an omitting diagnosis, a chief complaint during an ED visit, problem complications that happened during a past visit, a previous medical history or an existing condition, also a family history, also discharge diagnosis. Here are some entry points for submission of health issues: using the admission order set, during a completion of an H&P, during daily rounding, using the discharge order set, also via the health issues icon. This slide illustrates ICD-9, ICD-10, and SNOMED and what the differences are. Currently at Carson Tahoe, we use ICD-9 codes. Slated sometime in 2014 to be determined, ICD-10s will be implemented. Also, SNOMED CTs is an international terminology system for information input into the EHR system. Describes and defines clinical information for primary data purposes. Currently used today in EHR systems, but not at Carson Tahoe. When we activate 6.1, ICD-10 and SNOMED will be viewable. However, through preferences, we will be able to eliminate them from your view. Let's see a demonstration now of SCM Health Issues Manager. Welcome to the SCM Health Issues tutorial. Let's begin. SCM is open. I have selected my patient list. Your main toolbar, your main icon toolbar, your patient header, and your patient chart tab will remain the same in 6.1. For this demonstration, I will select Salmonella. Notice now that the patient information has defaulted in. Health Issues icon is located on the toolbar in the first position. It may be located at a different position on yours. Through preferences, you can change and activate your icons and move things around. Click OK to close the window. Let's begin with Health Issues. Health Issues Manager screen now is split. Salmonella patient information is located at the top, and to add a new health issue is located at the bottom. In a previous slide, we indicated that ICD-10 and SNOMED may be viewable on your screen. You can deselect these by going to the column selection, go to Select Health Issue List column, and deselect ICD-10 and SNOMED. For your view, if you want to deselect others, you can just go down the list and uncheck. Click OK, and notice that the adjustment has been made to the Health Issues main toolbar. Let's add a new health issue. In the omitting diagnosis, I'm going to use the full catalog search. I'm going to click on Full Catalog. In the ICD-9, it has listed, I'm going to put in CHF. Over to the far right is a magnifying glass, which if you click on, will list the health issues of congestive heart failure. I'm going to select Health Issues, click on Add. Notice that the congestive heart failure defaults in as the admitting diagnosis. As a chief complaint, I'm going to put in shortness of breath, and you can abbreviate SOB. I'm going to select the magnifying glass again, click shortness of breath, click Add. I'm going to put in a family history. I'm going to use my Favorites tab for this. I'm going to use a history of diabetes. I'm going to select diabetes, click on Add. Notice now that diabetes has defaulted to the top as a family history, and the scope is really just a general. Next, I'm going to add a primary diagnosis. I'm going to go to Browse, and I'm going to use Family Practice. I'm going to select hypoxemia and click Add. I have a primary diagnosis, a family history, an admitting diagnosis, and a chief complaint. If I want to add a working diagnosis, I can go to my favorites and let's add congestive heart failure. We've already have it listed as an admitting, so let's list asthma as our working diagnosis. Click Add, and now asthma is listed. If you want to view your screen a little bit more, you can just select and use the slide bar, and you have a more viewable access to your screen above. Say for instance I want to remove something. Let's remove this primary diagnosis. You can select. There's two ways to delete, either through your delete button, or you can actually right click and you have the same options in a right click. Click on delete. Go to confirm delete, click yes. Now I'm finished with my history. I've added my health issues. I want to save this. To the far right is your action list. Click done, and this is saved. Know that your health issues has deselected off the window. If I want to add still, I can go to my add button, click add, and I can add another diagnosis. Let's go into med-surg history, and I'm going to full catalog search, and I'm going to say appendectomy. Click on my magnifying glass, history of an appendectomy. Click on appendectomy, click add. Because I've added a new health issue, I will have to go and reactivate the done and click save. Now my health issues are there. I hit the close button on the far right hand side, and it deselects back to my patient list. If I want to verify again, I can click on health issues, and all my health issues are there. And I'm going to hit close. This completes the tutorial for SCM health issues. Please proceed forward with Part 2, Adding and Copying Favorites, Health Issues Manager.